morning. Welcome to our first show from Monroe Community Mental Health Authority. It's called Mental Health Matters. I'm Lisa Graham. I'm the Chief Executive Officer for Monroe Community Mental Health Authority. And I wanted to do this show to start giving the community information about all the things that are happening over at our agency. We're finding that we offer so many services that people aren't always aware of, so we wanted to do this show to make people aware of the various services and supports that you can find if you call or walk into our agency. So Monroe Community Mental Health Authority is an outpatient behavioral health clinic. It's been serving Monroe County residents for well over 50 years. We are located on Raisinville Road, right next to the fairground. And we also are really excited to talk about our newest location, which is at the Benish Building on Monroe Street. That address is 428 South Monroe Street. And that's another location where you can walk in and you can access services, ask questions. You can schedule any appointment that you might have right here at the Benish Building. So we have two locations now to serve the residents of Monroe County. I wanted to update community to let you know that we provide services to about 2,600 people every year. And we have a whole range of services. We have psychiatric services, therapy services, case management. We provide services for people who have disabilities to live in their homes more independently. We provide respite services for caregivers. We have a great clubhouse program that provides psychosocial rehab for people every day. And I'm also really excited to talk about a new program that we are starting tomorrow. And it's something that we've been planning for a while now, and it's something that we've heard from the community that is really a big need, and that is a mobile crisis unit. The mobile crisis unit is going to be able to respond to people who call in a crisis situation with a mental health crisis and be able to come out to wherever you are so that you don't have to necessarily go to the hospital or go somewhere else. We're going to try to be able to come to you and help assist you with whatever crisis you're having in the moment, and then determine what the best next steps should be. And in the next section, we're going to talk with Sheriff Troy Goodnough about this mobile crisis unit, and also the Monroe Community Mental Health's Access Program Director, Adam Anastasoff, who's leading this program. So in just a few minutes, we're going to talk about that. Hi, welcome back to Mental Health Matters. I'm Lisa Graham, and I'm really excited to introduce Adam Anastasoff and Sheriff Troy Goodnough, who are our guests today, talking about our new mobile crisis unit that is going to get started in Monroe County tomorrow morning. Is our launch date. Welcome.
Well, thank you.
Adam, can you tell us a little bit about the history of the mobile crisis unit? When did we start at Community Mental Health thinking about the need and planning for it?
We started thinking about it probably about a year ago, around about when I started coming into this position. We saw the need. We knew the need has been there for quite some time. I've been doing the after hours crisis line for about 12 years now, and it has its limitations. I mean, we can help with a lot of crises and manage a lot of things, but we are not mobile, we're not in person, it's audio. And there are times where people need people present as well as, when you get into like the co-responses of law enforcement for sure.
Yeah.
So.
Yeah, and so just to clarify, CMH has always had a 24/7 response, but it's always been through the phone line.
That's correct. Yeah. So the crises calls come in, and we manage the crises over the phone. And if it got to the place where we couldn't diffuse it, we were relying on law enforcement to help out in those situations solo, where we hope to be involved much more in those calls now moving forward.
Yeah. Yeah, and Sheriff Goodnough, you and I have talked about this for the last year or two, like the desire to have a co-response unit, the ability for you and your team, when you go out, to get a mental health expert on the scene sometimes. That's been a dream for a long time. So tell us a little bit about what you see when you respond and how you think this is going to be able to be helpful.
Yes, and before I do that, I want to kind of give a little history, if that's okay.
Sure.
So let's go back to 2014 when the Sheriff's Office found ourselves in a situation where services were limited to our inmates in our jail for mental health. At that point, we partnered with community mental health because, well, let me even go back further. At one point, there was a grant that funded an individual from CMH that was in the jail. When that grant funding ran out and financial resources were restricted, that position was never refilled. So in 2014, we partnered again with CMH. We developed and submitted a grant program to fund a jail diversion program in our jail for individuals that suffer. And over the years, since that date, we have continued to build our partnership. We have great outcomes with our inmates in the jail to the point we had a 37% reduction in recidivism. But when we spoke back in 2014, we kind of said, how do we address this issue today? What do we look at in a couple years? And what's our long-term goal? And at that time, our long-term goal was, even before you heard this across the country about this co-response, right? I said it would be an excellent idea and model if we could put a clinician in a patrol car. That way we respond, and if it's a situation that doesn't necessarily require law enforcement engagement, we now have a certified individual from the healthcare or mental health field and behavioral health to engage that individual, defuse, and come to a common resolution without the use of force. Having that individual in the patrol car also gave them a security measure. If the situation escalated, now they could feel comfortable in doing their job knowing they had someone there to protect. So we know we didn't get there until tomorrow. We're close. We're one step closer. And we are thankful, and I speak from the law enforcement community, specifically the Sheriff's Office. We welcome this engagement. You know, we've had the opportunity for your staff to come in and teach not only our correctional staff, but our uniformed services staff as well on mental health first aid. Give them that tool for their toolbox. But they're law enforcement, they're police officers, they're criminal justice practitioners. They're not certified behavioral health clinicians. So there's that gap, right? So we welcome this opportunity, having, starting tomorrow morning, that ability to call that crisis line and say, hey, we're here at this address. This is the situation we have. Can we get somebody on scene now? And we know our goal has always been superior service. And sometimes we had hurdles that prevented us. We did the best we had with the tools that we had. Now, this is another tool in our toolbox for law enforcement to call up and say, hey, we need this clinician, this individual on scene now. So now the officer's there, the clinician, in my view, responds. They can exercise their skill set and what's best for the consumer, and now we can also give them some sense of security and protection. God forbid the situation was to escalate. So I hope that we continue to build on this platform, and someday we can put them clinicians in those patrol cars. And again, my vision is have one on 24/7. But this is such a fantastic step in that direction. And it will really give us an opportunity to say, maybe we don't need to go to the clinician in the patrol car. Maybe this model works. But it'll give us some anecdotal and some factual information to say yes or no, it doesn't work.
Yeah, you make so many good points, Sheriff. First of all, yeah, it's a great first step, and we really want to thank the county, Monroe County, because we were able to get this mobile crisis unit started because of the award through the ARPA funding. So that's really great. But the funds were enough to let us get the crisis unit started, and also but only to staff it for one shift 7 days a week. So we do have that limitation. Like you said, it's a first step. But the good news is we just yesterday at CMH posted the jobs so that we can hopefully by October 1 staff this mobile crisis 24/7, 7 days a week. So that's our next goal, is to increase the number of shifts that we're able to provide the service. But you know, obviously this is something that's so good for the consumer, for the person who is experiencing a crisis. It helps to get the right service to them in the moment. And then for for law enforcement, like you said, who are not necessarily behavioral health specialists. They have a skill set, and then we have a skill set that we can bring. So that hopefully helps improve the health and get people the help that they need, the right help. But also I'm imagining it can help prevent you guys from having to keep going out to certain places, because when we get people the help they need the first time and we really address the root cause, then hopefully that frees up your guys and women to respond to other scenes.
Well, and I'm glad you brought that up, Lisa. You know, we partnered about 4 years ago, where when we went to these situations that weren't necessarily law enforcement centric, but we had a referral form, and that has proved to be a great resource of connecting these individuals with services that they may have not had access to. And that has been a tremendous asset. I know we're well over 700 or 800 referrals just based on that. Again, it's this partnership. CMH is not in a silo doing it alone. The law enforcement is not in a silo doing it alone either. And I think it's important to mention, we know in Monroe County we do have barriers with transportation, and especially our outlying areas. This mobile crisis unit now gives us the opportunity to get into these areas where transportation is a barrier. You know, it's great. I hats off that you folks now have the satellite station here at the Benish building, because now we're closer to downtown where we do have access to the public transportation system. The consumers that do live in the city of Monroe can potentially get there if necessary on foot. Not always the case out at South Raisinville Road.
Right.
They have to walk along the road edge. There's currently not a sidewalk or a bike path out there. So again, hats off to you and your organization for having the satellite station here at the Benish building. But now we have this third component of this satellite. And Lisa, correct me if I'm wrong, but I think this mobile health crisis is also substance abuse. Is that correct?
Yes.
So if we encounter these situations, and this goes right along with our opioid settlement funding that the County of Monroe's received, that is also going to CMH to continue to build on this concept. Because we know, and the little bit of information and knowledge that I have, the co-occurring disorder. And I think, I'm confident at the end of the day, the outcomes of these programs, they ultimately will turn around the dilemmas, the concerns that we have in our community with behavioral health and substance abuse disorder. And in your organization, law enforcement, and as you said, we have to pay thanks to the County of Monroe for choosing, and our Board of Commissioners, to leverage this funding. They see the need to support these programs. And as I started to say, I'm confident we are going to be the leaders across this country. These organizations coming together, collaborating for the well-being and the benefit of our residents.
Yeah,
So.
absolutely.
You mentioned the substance use, and I'm glad you brought that up, because we do want to make that part of the effort, and we have the partnership already with MCA in getting us data for overdose reversals in the community, and we've been responding to that and trying to engage those individuals, but it's been sort of, we've been using what we have, which is not much, to try to do that. Now, with the Crisis Mobile, we can make a more concerted effort to actually really get out there and really engage those individuals, pass out Narcan, get them involved and engaged in resources for hopefully treatment. Well,
what do we want? Long-term treatment, so that these individuals, give them a hand up, give them an opportunity to be productive members of society. This is somebody's brother, sister, aunt, and uncle, and they just need that one opportunity to say, we care.
Yes.
And I have to share with you, as I was at a local business here in Monroe yesterday, and an individual at the counter approached me and said, Sheriff, I want to say thank you. And she went on to talk about, she was incarcerated. She was in a bad place. And I kind of sensed, without getting into detail, potentially behavioral health and substance abuse. And she said, because of the programs in the jail, look where I'm at today. She's working, making a living, and she made a comment, I'm not proud of my past. And I said, but you learned from your past. And that's what we ask people to do. We don't want to incarcerate them as necessarily a form of a punishment. We want to change their behavior. And that coincides, in my opinion, behavioral health and substance abuse disorder.
Right.
And I'd be remiss if I didn't, again, thank CMH for partnering with us on putting Narcan of the vending machine in the lobby of the sheriff's office.
Yeah.
I think we can all in society say that was a hard pill to swallow, because are we adding to and encouraging people to use substance because now there was a mechanism in place if they overdosed to save their life, you know? And we never wanted to do that.
Right.
But at the end of the day, every life has value. And, you know, I was one of those individuals that had to really take a hard look and say, is this the right thing that we want to do? We don't want to look like we're promoting drug use.
Right.
But at the end of the day, if we save that one individual that says, you know what, I was so close to seeing them pearly gates that I'm going to change my life, that's what it's all about.
Yeah, and I'm really so thankful for the partnership that we have, and really under your leadership, Sheriff, helping everybody come along to that concept, because substance abuse is still one of those areas that still unfortunately has more stigma attached, and people do tend to view it, even people who are living with substance use disorder, they do a lot of self-stigma as well, like, I should be able to just be a better person, I should be able to kick this, and it is a disease. And I kind of give the example of, if a person has diabetes and they continue to eat donuts, are we going to just say, too bad for you?
No, she had to throw the donut thing
We're,
out there, right?
right?
She couldn't say
Sorry,
a brownie.
it's a brownie, whatever. Pastries. If they continue to, eat sugary treats, then we don't say to them, well, too bad for you. You knew better. You're a diabetic and you shouldn't have done it. And so why do we still put that stigma on people who have a disease? And so I'm so happy that we have that vending machine, or that people can get that for free. They have that resource. I know that another resource like that just popped up in St. Joe's, just put one, I think, at the Village, Oaks Village. I think there's a new vending Narcan. And then Adam, talk about what will happen. So if someone of Sheriff's guys or women call tomorrow and say, I need a co-response, what can they expect? What can our community expect from this mobile crisis unit?
Yeah, the expectation is that the crisis mobile unit is deployed immediately, and we're going out to get onto the scene as soon as possible. We are going to be ready and available to deploy. The only thing that would prevent us from deploying immediately is if we're on another call, handling another situation at that time. But we're going to get out there. We're going to consult with law enforcement to see what's going on with the situation. We're going to let them be the lead and kind of fill in where we need to, and just find that really good partnership to be able to handle the situation appropriately. Like Sheriff had pointed out, so many of these situations are behavioral health in nature, and they might just need a listening ear. They might just need to feel heard. And sometimes when people are in the mental health crisis, just the very presence of a uniform can trigger more symptoms. And it's no blame to the officers. They could be doing the best job in the world, but the fact that they have the uniform on with somebody with paranoia, it can trigger more things. So if we're able to step in, we know the scene is secure and safe. Law enforcement ideally can get on with their way and respond to other things in the community that they might need to respond to, and we can handle this situation.
That's great. And then Adam, as I understand it, it doesn't stop there. So you have an interaction with someone, you provide a service, a crisis service, but that's not the end of it.
No. Yeah, every crisis we respond to, we will also be following up with. Obviously, it would depend on whether or not they are open to our services at that time or not, as to whether the treatment team responds or the crisis mobile responds. But the expectation is that we would respond within 48 hours of the crisis to ensure that the crisis and safety plans are being followed, any referrals made are being followed up on. And then again, within 7 days, we want to follow up again to do more of the same. the crises getting better or worse? Are the referrals panning out? Do we need to make more referrals? What do we need to do to make sure that we're executing and preventing further crises from occurring?
Mm-hmm. That's awesome. I'm really happy to hear about the follow-up piece as well. With any new initiative like this, there are going to be bugs that have to be worked out, right? You can I can guess that by Monday or Tuesday, we're going to hear about some things that didn't go well. How are we going to work together, our two agencies, to make sure that we're aware of and addressing those? Because the worst thing is you get a tool, it doesn't work, you kind of throw it away if it doesn't work the first time, and you never use it again. We want this to be something that we're continually building on and getting better and better. And like I said, hopefully by October 1, we're running this mobile unit 24/7.
Yeah.
So what are we going to do to partner and make sure that we're making this happen?
Well, I feel like that's the benefit we have is we've worked with law enforcement in this community for so long. Our relationship is so great, and kudos to Sheriff because he's spearheaded many of these projects. So we are in alignment in so many ways in this community to just serve the community better. So I've already put my name and my number out there to law enforcement. Any feedback, comments, concerns, anything can be directed straight to me. Just like in some of our other programs we've launched and spearheaded, we've had regular meetings with various stakeholders. We've drawn tons of process maps. But just continuing to meet and discuss and work out the bugs. We don't give up on any of these ideas. We know that these are just lessons learned, and we can use the feedback to change and develop. I'm of the opinion I'm never satisfied with where my programs are. There's always room for improvement, no matter how long you've been running them. And so we're excited to get in there and see what we can learn. Certainly can't plan for every contingency. So I know, like you said, there's going to be things to work out, but I'm confident we can do that.
Yeah, that's great.
Yeah.
Sheriff, what is the feeling from law enforcement about this mobile unit?
Obviously, any help we can get is a positive for us. And we're going to be rolling the video. Adam was grateful enough to create a video and a one-pager. So at 7 p.m. tonight at our shift briefing, we'll start rolling it out to our staff. And we're going to play the video and the one-pager to make sure that we hit all of our staff at the Sheriff's Office. And I know in communication with Director Tolstead from the city, they're going to be doing that as well. I haven't had any communication with the state police, but we are obviously going to include them as well as Central Dispatch. At the end of the day, we have to look at the impact this is going to have. And Adam, I think you mentioned it early on in this conversation. Take those law enforcement personnel and allow them the ability to respond to a call for service where their services are needed. And not that they're not needed here, but once that scene is quelled and the clinician feels comfortable, it gets those officers back into the community doing what their job is.
Yeah.
Not that this is not part of their job, but what's their primary focus and responsibility.
Right.
And we reduce response times to those calls for service. I think it's important to mention, we started the referral service. We had one individual that we responded to in 1 month time, 40 times. And if you remember, we responded with fire service, ambulance service, and law enforcement. And when we got, when we were able to get the referral form and this person the assistance, to my knowledge, Adam, we've not been back there since. So what does that do? Just think of the money that was spent on those services that were sent to that residence. But not only that, is you're moving these emergency vehicles down the road. Now you put everybody in harm potential because they're trying to get to an emergency call. So when you remove that, it's a safer transition for our entire community. And I think that's important.
That's great. Yeah, that's great. That's a great story. And I hope we're going to have many more stories like that. So Adam, you don't have to call the police to get the mobile crisis unit. Tell us how else we might be able to deploy this unit.
Yeah, I did want to bring that up, so thank you. So the Crisis Mobile team can be deployed in 3 different ways. It's directly through law enforcement. by our after-hours team and by our internal supervisors. We encourage the community to continue to use our regular local crisis line, which is our main number, 734-243-7340, option number 1. And they will be connected with somebody on the phone. And we want to make sure that that continues to happen because they have the ability to help us triage. Because we also want to make sure that our crisis mobile team has the availability and opportunity to be readily available to be deployed where needed. If things can be sorted out over the phone, we're going to sort them out over the phone. If in presence a response is needed, we will do that. But we want to make sure that we're readily available for law enforcement, and then the community, we can continue to use that number for getting a hold of us.
That's great. So the community won't be able to call and request the mobile crisis unit directly, but you can always call our main number, the after hours number, or 988 to get a behavioral health emergency response. And then that person who's taking that call may make the decision that the mobile unit is the most appropriate resource to send.
Yeah, that's correct. That's the idea.
Okay.
I mean, essentially, we're working to be among the first responders in the community. We have police, fire, EMS, and where's mental health in the equation, right?
Right.
So.
And we need to be there.
Mm-hmm.
So that's great. That's a great statement to end on. We're really happy to be partnering with law enforcement, with other first responders to address emergencies in the community. And I know this is going to be a great program. I can't wait to have you guys both back in a few months, and we'll talk about the successes that we've experienced and any lessons learned, and maybe how we're changing things up a little bit. But good luck to us tomorrow, right? And thank you for being on the show today, Sheriff.
Mm-hmm.
Thank you, Adam.
Yeah.
Appreciate it. And thanks, everybody, for tuning in, and we'll see you next time.
Hi, Crossroads Clubhouse is doing a bottle and can drive for, pop bottle and can drive for the communications program. And we're at the Benish building right next to the Tim Hortons on South Monroe Street. Our address is 428 South Monroe Street, Suite 101, and we are collecting them to hopefully raise for items that we need to edit our videos, and we could collect them any time of the week. And if you can't deliver them, we could pick them up by calling us at 734-243-6401. So we hope to see you soon.